Anderson, when it comes to how many American hospitals are really prepared to accept Ebola patients, the answer is really only a handful. You know, before this case, we had Emory here in Atlanta, the Nebraska Medical Center. They accepted Ebola patients, but they knew they were coming in advance. They had a chance to prep the staff. This Texas case, this is the first walk-in, Anderson, of an Ebola patient. The hospital clearly stumbled, and that, say infectious disease experts, really needs to change.
We have a lot of hospitals that aren't prepared and really probably don't even want patients. And so what we've seen that hospitals now are downloading paper-based guidance plans from the internet, and they're now working out how to do the management, how to do the implementation, and how to make these things happen to ensure that if they do unfortunately get an Ebola patient, everyone in the hospital is going to be safe.
Wow, they're downloading stuff from the internet. That's not exactly comforting. Are there guidelines at those hospitals and other hospitals about medical wastage generated by treating Ebola patients?
You know, that's a good question, and it speaks to what Elizabeth Cohen was talking about with that vomit in an ambulance. There's a lot of waste. It's got to be gotten rid of safely. You know, at Emory, they had the 2 patients here. A doctor told a staff meeting at the peak, when they were treating those 2 patients, they were generating up to 40 bags of medical waste a day. And what then? You know, every hospital has procedures, Anderson. Practically every hospital in the country hires outside contractors to take care of the trash. In the case of Ebola, waste, however, the rules are still being sorted out. A Washington-based trade group that represents these waste haulers told us basically that current federal regulations effectively restrict transportation of this material.
So, are you willing to take away what is a level 4 category A disease and disperse and get rid of that waste safely? And we believe that's not there at the moment because we haven't tested it. We haven't visited the hospitals, we haven't done risk assessments, and we haven't done on-site visits and evaluated their capabilities and their competencies and their capacity.
Look, the waste is more of an administrative problem, really. But you've got to, you know what you have to do to prepare for this? You've got to drill. These hospital staffs need to get their act together, Anderson. They got to deal with the very real possibility that tomorrow one guy could walk in, say, I've been to Liberia, and have a fever. Right now, this stumble in Texas, as bad as it was, may have led to more people being exposed. It could be a great wake-up call for every hospital out there that's basically been putting off these kind of drills and are now downloading papers on how to handle Ebola patients.